Hey, SciSphere listeners, it feels like every day the news just has more and more about climate change
Yeah.
and how it's affecting all of us. And today we're looking at, well, you might say a surprising connection.
hmm
We're going to be talking about the climate crisis and
And HIV.
two big global
You
challenges.
might be thinking, what?
They're more connected than you might think.
Yeah, what does one have to do with the other? Well, we've got some really, really interesting reports here. We've got one from the Lancet Countdown on Health and Climate Change. We've also got some information from Médecins Sans Frontières.
MSF,
MSF, yeah.
they do some amazing work.
Incredible work. And then just a ton of research that's showing that these two issues are really deeply connected.
Yeah.
So get ready, SciSphere, because we're going to be going really deep today. We're going to be looking at how extreme weather, displacement, and even just struggling healthcare systems are playing a role
In the HIV
in
epidemic.
the HIV epidemic, yeah. Especially in those vulnerable communities. Yeah, and it's not like some far-off problem
Yeah.
that we're going to see the effects of in the future. It's happening right now.
Right.
Take South Sudan, for example.
Right.
MSF's reports show that South Sudan is really struggling to meet the UNAIDS targets for HIV. And a big reason for that is conflict and climate emergencies.
Okay, so you've got a place that's already dealing with conflict. You've got a place that's already dealing with all these existing kind of societal problems. And then you add on top of that climate change.
Yeah, and a lack of resources,
And
too.
a lack of resources.
Yeah, it's really a tough situation.
So paint a picture for me of what that actually looks like. When you add climate change on top of all of those things, what happens with HIV? What are we seeing there?
Well, healthcare systems are already really stretched thin.
Yeah.
And then you add in a flood or a drought on top of that.
Yeah.
It's like suddenly supply chains are disrupted. Getting treatment to people who need it becomes really difficult and diagnoses get delayed.
Wow.
It's a bad situation.
Yeah. And it's so interesting because if I'm remembering correctly, South Sudan relies really heavily on external funding, right? For their healthcare system.
Absolutely. Places like the Global Fund, PEPFAR, those are crucial for South Sudan.
But then those organizations are relying on accurate data from UNAIDS
Right.
in order to allocate those funds effectively.
Right.
And when you have a country that's in turmoil, where it's hard to even collect that data in the first place, and then climate shocks hit, it becomes even harder
Exactly.
to even understand where the needs are.
Yeah, it's a vicious cycle.
Like a vicious cycle. The things that make it hard to deal with HIV are being made worse by climate change.
Yeah, and this isn't just a South Sudan problem.
Yeah.
This is a global problem. You
Oh.
have to zoom out and look at the bigger picture.
Yeah.
The climate crisis is acting as a threat multiplier for HIV all over the world.
Okay, threat multiplier. That sounds pretty ominous.
Yeah.
What does that mean? Break that down for me in this context.
Well, it means that climate change is taking existing vulnerabilities, inequalities, the things that already make people more susceptible to HIV, and it just amplifies them.
Okay.
So if you're already dealing with poverty, lack of access to healthcare, or social stigma,
Right.
climate change comes in and just makes everything that much worse.
It's like kicking someone when they're down.
Exactly. And we see this happening in very specific ways. For instance, extreme weather events like floods and droughts are becoming more frequent and more intense.
Right.
And that has both direct and indirect impacts on HIV.
Give me an example.
Okay, so let's say there's a flood. On a direct level, you have damage to healthcare infrastructure.
Okay.
Clinics get flooded, roads are washed out.
Right.
People can't get to their appointments, testing, treatment, it's all disrupted.
Makes sense.
But then you also have those indirect impacts.
Okay.
The flood forces people out of their homes.
Displacement.
Right. It disrupts social support systems, and it can put people in situations where they're just more vulnerable to HIV.
So it's not just the immediate danger of the flood itself, but all of those ripple effects that it creates.
Exactly. And then there's the economic impact.
Yeah.
Climate shocks can wipe out crops and livelihoods. People
Right.
end up in poverty, and they might not be able to afford health care.
Right.
Or even just the basic things they need to survive. And that kind of desperation can push people into risky behaviors
Right.
that increase their risk of HIV.
And this isn't just hypothetical, right? We're seeing this play out.
No, it's real. The Lancet HIV, which is a top journal in the field,
Okay.
published a study that found a clear link between lower than usual rainfall in southern Africa and increased HIV transmission.
Really?
Yeah, when rainfall was low, livelihoods suffered, food insecurity rose, and HIV rates went up.
That's wild. I mean, it's something as simple as rainfall
I know.
having this effect on the HIV epidemic.
Yeah, it's really eye-opening.
It really shows how everything's connected, right?
Exactly, and to really understand that connection, we need to think in terms of systems thinking.
Okay, systems thinking. Now I'm
Yeah.
interested. Tell me more. What is that?
It's about looking beyond just the individual pieces
Okay.
and seeing how different systems, like the climate system, the environment, the healthcare system, social systems, all interact
Mm.
and influence each other.
So it's about seeing the bigger picture, the web of connection.
Exactly. And when we apply systems thinking to this climate HIV connection,
Okay.
the Lancet HIV study actually identified 5 key themes that emerge.
Okay, 5 key themes. Let's hear them.
All right, so theme number 1
Hit me with it.
is economic and livelihood conditions.
Okay.
And we've touched on this a little bit already, but it's really central to this issue. When you have climate shocks that disrupt agriculture, destroy infrastructure, force people from their homes,
Mm-hmm.
it just creates this cascade of economic hardship.
Right.
People lose jobs, they lose homes,
Yeah.
they lose their ability to take care of themselves and their families.
And that desperation, that leads to, situations where people are more at risk for HIV.
Right, exactly. We see things like transactional sex or survival sex,
Right.
where people are engaging in risky behaviors because they feel like they have no other choice.
They have no other options.
And it impacts their ability to access healthcare and afford treatment, even if it is available.
That's huge.
Remember that statistic, $264 billion in economic losses from extreme weather just in 2022.
It's a massive number.
Yeah, that's a huge blow to global economies.
Right.
And it really trickles down and affects the most vulnerable people.
In the worst ways.
Yeah. Okay, so that's economic hardship.
Okay.
The second theme
Number 2.
is psychosocial factors.
Ooh, okay. Interesting.
Yeah, this one's about the mental and emotional toll of climate change
Right.
and how that can impact HIV.
Okay, so we're talking about the psychological impacts of climate change.
Yeah.
Like, how does living through a hurricane or a drought affect someone's risk of getting HIV?
Right, well, it's about stress, anxiety, trauma. Yeah.
Imagine losing everything in a flood, watching your crops die in a drought.
Uh-huh.
These are incredibly stressful events,
Of course.
and they can lead to depression, anxiety, PTSD.
Yeah.
It takes a toll.
It makes sense. Trauma takes a toll on your mental and emotional well-being. But how does that connect to HIV specifically?
Well, when you're dealing with mental health issues, it can be hard to take care of yourself, prioritize your health.
Sure.
Like, we see people living with HIV struggling to stick to their treatment
Oh, okay.
when they're also dealing with the aftermath of a climate disaster.
Right.
Their mental health suffers, and as a result, their physical health suffers too.
Yeah, it's a good reminder that health is holistic.
Exactly.
You can't separate your mental and emotional health from your physical health.
Yeah.
They're all tied together.
Right, exactly. And there's a really good example of this from a study done in New Orleans
Okay.
after Hurricane Katrina.
Researchers found that people living with HIV who had PTSD after the hurricane were also more likely to experience food insecurity, to have interruptions in their medication,
Wow.
and a faster progression of their HIV disease.
Really?
It's a tragic example of how trauma can just compound those existing health challenges.
So we've got economic hardship.
Yep.
We've got the psychological trauma. What's number 3 on this list?
Number 3 is infrastructure damage and operational challenges.
Okay, and this one seems pretty straightforward to me, right? I mean, when a climate disaster hits, it damages critical infrastructure,
Exactly.
including healthcare facilities.
Yeah, we're talking roads washed out, clinics flooded, power outages,
Yep, all of that.
all of it. And when those services are disrupted, it becomes incredibly difficult to provide HIV prevention testing and treatment.
I mean, even if people can physically get to a clinic,
Right.
the clinic might not be functional.
Right. Or the staff might be dealing with their own losses and trauma.
Right, of course. So it's like this dominant effect.
Yeah.
Climate change triggers the disaster that cripples the healthcare system,
Yeah.
and then that makes it harder to combat HIV.
Exactly. And it's not just the immediate aftermath of the disaster either.
No.
It's also the long-term operational challenges,
Huh.
like rising temperatures.
Oh,
It can make it really hard to store and transport medications,
Of course.
especially in places that don't have reliable electricity.
Yeah.
So it's not just those big dramatic disasters,
Right.
it's those slow-burning challenges too.
Those slow burn challenges. Okay, so what's next? What's number 4?
Number 4 is migration and displacement.
Okay, so we talked about this a little bit earlier,
Yeah.
but it's such a big issue that it's worth digging into a little bit deeper.
Absolutely. Climate change is already forcing people to leave their homes, and it's only going to get worse.
Millions of people.
Millions of people.
And when people are displaced,
Uh-huh.
it just adds this whole other layer of complexity
Right.
to the HIV epidemic.
Right, because people are on the move.
They might lose access to their health care.
It's exactly.
They might end up in a new place where they're more vulnerable to HIV.
Right. Their social support systems are disrupted.
Uh-huh.
Their routines are upended.
Right.
And they might end up in a situation where they're more likely to engage in risky behaviors.
And I would imagine there's probably like more discrimination,
No, absolutely.
stigma in those new places,
Yeah.
which can make it really hard for people to access health care
Exactly.
or even admit that they need help.
Right. And the scale of this problem is huge.
Yeah.
The World Bank estimates that by 2050, there could be as many as 216 million people internally displaced by climate change.
That's a mind-boggling number.
It's a huge number of people whose lives will be disrupted.
Wow.
And whose health will be at risk.
Okay, so we've got the economic hardship, the psychological impacts, the damage to infrastructure, and the displacement. What's the fifth and final piece of this puzzle?
All right, number 5 is associated medical conditions and healthcare needs. And this is about how climate change impacts overall health, which then indirectly affects the HIV epidemic.
So we're talking about the ripple effects of climate change on health in general,
Exactly.
not just HIV specifically.
Right. Climate change is linked to so many health problems, like heat stroke, respiratory illnesses, malnutrition, infectious diseases. And when people's overall health is weakened, they're more susceptible to HIV.
Of course.
And it makes it harder for them to manage their HIV if they already have it.
So it's like climate change is weakening the body's defenses, essentially,
Exactly.
making it more vulnerable to all sorts of things.
Right. And it also puts a strain on healthcare systems that are already struggling.
Right.
When you have more people getting sick from climate-related illnesses, it takes resources away from other priorities like HIV prevention and treatment.
Like a double whammy.
Exactly. So this brings us to a really important question.
Yeah.
What can we do about it?
Yeah, that's the big question, right?
We've talked about the problems. Now let's talk about solutions.
Okay, I like it. I'm ready for some solutions. Bring on the hope.
All right, so there's definitely hope.
Yep.
It's not a hopeless situation,
Right.
but it requires a multi-pronged approach. We need to think about both adapting to climate change
Okay.
and mitigating it.
Those classic climate change strategies, how do they apply specifically to the HIV epidemic?
So adaptation means adjusting to the current and future realities of climate change.
Okay.
In this context, it means building healthcare systems that can withstand those climate shocks
Right.
and continue providing essential services even when things get tough.
So basically making sure that healthcare can still reach people, even in the face of floods, droughts, all those climate-related disruptions.
Exactly. So what does that look like? What are some concrete examples?
Yeah.
Well, for instance, some countries are starting to adopt multi-month dispensing of antiretroviral medications.
So instead of people having to go to the clinic every month,
Right.
they get several months worth of their medication at once. Right.
Exactly. That way, even if there's a disruption in the supply chain because of a natural disaster or something, they still have their meds.
That's awesome.
It's about being proactive.
Yeah, I love that. It's like taking away those barriers to care
Right.
and meeting people where they are.
Exactly. And another important strategy is prioritizing HIV testing for people who are at high risk
Okay.
and expanding self-testing options.
So it's about giving people the tools
Right.
to take control of their own health,
Exactly.
even when the system's struggling.
Yeah, exactly.
I like it.
And we can't forget about technology.
Oh, yeah.
Electronic and mobile health strategies are really changing the game.
Okay, tell me more about that.
We're talking about using technology for remote counseling, treatment, adherence support.
So even if the clinic is damaged, people can still get the help they need.
Exactly.
I love that. Telehealth for HIV, essentially.
Exactly.
Naturally.
And then there are also climate-informed health early warning systems.
Okay, so that's like using data to predict potential health impacts
Right.
so that you can take action before things get bad.
Exactly.
That's really smart.
So those are some examples of adaptation.
Okay.
But we also need to talk about mitigation.
Right. So how do we slow down climate change itself? That feels like such a massive problem.
It is a massive problem.
It feels overwhelming sometimes.
Yeah, I get that. It requires a global effort.
Yeah.
We need governments to step up. We need industries to transition to cleaner energy sources.
Right.
We need to reduce our reliance on fossil fuels.
Yeah.
And we need to adopt more sustainable practices across the board.
It's the big picture systemic change stuff that we hear so much about.
Yeah.
But I think a lot of people struggle with this feeling of like, well, what can I do?
Yeah.
As an individual? Does it even matter?
I understand that feeling. It's easy to feel powerless in the face of such a big problem.
Yeah.
But the truth is, every individual choice does make a difference. Every time you choose to walk or bike instead of drive, every time you choose local produce, every time you vote for leaders who prioritize climate action, you're part of the solution.
It's about those little things adding up.
Exactly. Individual actions create collective impact.
I like that. So it's about shifting our mindset,
Right.
recognizing that we all have a role to play,
Yeah.
and then making choices that support a healthier planet.
Exactly.
Now, what about research and innovation? Where do those fit into the solution?
Research and innovation are so important.
Okay.
We need ongoing research to better understand these links between climate change and HIV.
Especially in those vulnerable communities.
Especially in vulnerable communities, exactly.
Yeah.
And we need to develop and implement new solutions.
What kind of stuff are we talking about? What are some of the cool things that are being worked on right now?
Well, for example, researchers are working on developing what are called optimized chemical synthesis routes for HIV drugs. And what this means is that they're trying to find ways to make these drugs more environmentally friendly to produce.
Oh, interesting.
And also less expensive.
So it's about making treatment more sustainable.
Right.
And more accessible.
Exactly.
I love that.
It's a win-win.
Yeah. What else is on the horizon?
Well, there's also been a lot of excitement around long-acting HIV treatments.
Okay, I've heard a little bit about these.
Yeah.
Tell me more.
These are treatments that could be revolutionary.
Okay.
Because they would only need to be given every few months.
Wow, really?
Which would improve adherence? Right. Because
Yeah.
people wouldn't have to remember to take a pill every day.
Yeah.
And it could also potentially lower the environmental impact.
How so?
Well, because you wouldn't need as much frequent dosing.
Okay.
You wouldn't need as much packaging, as much transportation.
So less waste.
Less waste, more convenient treatment, better adherence.
It's a win-win-win.
Exactly. That's fantastic. And then another area where there's a lot of innovation happening is in climate-smart medical devices and technologies.
Okay, what does that mean?
It means developing healthcare tools that are more sustainable, more resilient to climate shocks,
Okay.
and just designed with the environment in mind.
So thinking about sustainability at every level of the healthcare system.
Exactly.
From the drugs that we manufacture to the devices that we use.
Right. And finally, we can't talk about solutions without talking about climate justice and health equity.
Of course not. This is something that we talk about on the show all the time, that climate change and HIV, they disproportionately affect marginalized communities.
Exactly.
And those who are already facing a lot of systemic disadvantages.
Absolutely. They're more likely to be harmed by climate change,
No.
and they have fewer resources to cope with those harms.
It's a double injustice.
Right,
Yeah,
exactly. And in the context of HIV, this means that climate change is widening the gap
Right.
between those who have access to prevention, testing, and treatment, and those who don't. Right.
So we need to prioritize the needs of these communities.
Yes.
We need to empower them to be part of the decision-making process.
Right.
And we need to make sure that they have equitable access to resources and services.
It's about shifting power dynamics,
That's right.
amplifying the voices of those who are most impacted,
Absolutely.
and building solutions that are truly community-driven.
Exactly.
All right, so Size for listeners, as we're wrapping up this first part of our deep dive,
Yeah.
it's pretty clear that climate change is not just an environmental issue.
Right.
It's a health issue.
Absolutely.
With huge implications for the fight against HIV.
Yeah.
We've explored some of the ways that these issues are connected, from the direct impacts of extreme weather to those indirect impacts like economic hardship,
Right.
displacement, and weakened health systems. We've talked about solutions, both in terms of adapting to climate change that's already happening
Yeah.
and mitigating future climate change. We have highlighted some of the work being done in research and innovation.
And policy to try to tackle this crisis head on.
Yeah.
But there's still a lot more work to be done.
A lot more.
And a big part of that work is just raising awareness. Right?
Absolutely.
Talking about these issues, connecting the dots, making sure that people understand how deeply climate change is affecting the fight against HIV.
Yeah, because knowledge is power.
Right.
Once people understand the problem,
Yeah.
They can start demanding solutions.
Right.
They can hold their leaders accountable.
Yep.
And they can make choices that support a healthier planet and a healthier future for everyone.
So, Sciosphere listeners, don't let this be the end of your deep dive.
No, keep going.
We've got links in the show notes
Yeah.
to all the reports and studies that we've discussed,
Check 'em out.
so you can learn more about this incredibly important issue.
It's important stuff.